Hi, I am Cheryl Kemp, the nurse navigator from DMC Sinai Grace. I am representing the Detroit Medical Center. Please join us today, Saturday, March 7th, or Saturday, March 21st, at the Detroit Coffee Lodge. We are located at 19737 James Couzens. We're in conjunction with the San Bernardo Park Association and the Detroit Medical Center. We have a coffee chat with the doctor. Please come out and see what the doctor has to say. March is colorectal cancer screening month. Please speak with your doctor about your colorectal screening, or you can contact the Detroit Medical Center at the QR code below and get your questionnaire and your GI appointment scheduled. Again, join us at the Detroit Coffee Lodge for our March session, Saturday, March the 7th and March 21st. Thank you.
Hello.
Hello.
My name is Michelle George, and I also work for the Detroit Medical Center. I am an infection preventionist, basically an infection control nurse that makes sure we try to keep them infections out the hospital from the bloodstream and everything going on. But I've been a registered nurse now for 33 years, and I worked in areas. I've been a nursing instructor. I worked down at Detroit Receiving. I worked outpatient health clinics. I worked at Oakland County Health Clinic. One of my passions is infections. I treated patients with syphilis, gonorrhea, HIV. I gave medications to patients that the bats been in their cabin and had to do that. I worked for the TB program and influenza program. So nursing is always a passion of mine. I am mentoring the next generation of nurses. And I do also a lot of what I call advocacy, political nursing, to advocate, like the Flint water. I just speak before the Michigan State Legislature on the impact of water shutoffs in Flint. So, and with that being said, we will get started on some topics. Now, some of the topics that sometimes you're preaching to the choir, but we want you, and we want you to share this information so you will know what is going on, and you can always share. You got grandkids. Like recently I spoke at a grandmother's group. Their grandkids was vaping, and so they brought me in to speak to their grandkids as young as 13. And so if you got nieces, nephews, godchildren, you want to share this information. So that's what that we're going to talk about. I have 4 topics that I'm going to speak about. One of the topics is intimate partner violence. We see a lot of violence around that's going on where the intimate partner gets killed or murdered. We see that a lot. But it also starts with our young people. So I'm going to talk about intimate partner violence. I'm also going to talk about vaping, what we're seeing with the dangers of vaping. I was at a Red Lobster restaurant not too long ago. The person that was serving our food took the thing out, vape, and all the smoke coming out. So even employees are vaping. So it's just, but they don't know the harmful effects with vaping. Whether it's smoking or edibles, marijuana is bad for your heart. And so just recently in February, last month of February 2026, there were 5 students in Lansing at an elementary school someone shared the edibles. The kids ate the edibles and the kids got extremely sick. So we're going to talk about not just the dangers of marijuana, but also our young people are getting exposed to edibles. Chewing those edibles, but they don't know how dangerous it is. They think they're smoking, but they have a delayed effect, and then they wind up in the hospital emergency room, a lot of them. And we're going to talk about immunizations, get the facts about vaccines. Now we know we in this era anti-vaxxers, and it's okay. We always respect what parents have a right to know what's going on in their child's body. But me being a public health nurse at Oakland County, I vaccinated everyone for 15 years, from babies at 6 months old to 2 months old to 6 weeks. That's when we started the vaccines, till 95 years of age, and vaccines save lives. I can just tell you that. So we're going to kind of talk about, we have a measles outbreak. We're going to talk about how measles will wipe out your memory. That's what people do not realize, how dangerous measles is. And so we went 20 years without a measles case, okay? And then United States is about to get what you call off the elimination list, where 20 years, no measles, now we got measles epidemic. So we're about to get off the list where we got a measles problem. So we're going to talk about vaccines. So any questions before I get started? So vaping, facts about e-cigarettes. Vapes that contain nicotine are the most used tobacco products among youth. Did anybody know what the governor did recently a few years ago?
Made it illegal, right?
She went after the gas stations.
Oh,
Why?
gas
Yeah. You know why? How? Children, they start finding this case of popcorn lung, and we'll talk about that, which is called bronchiolitis obliterans. Very dangerous thing that the flavor from the vaping gets into the little tiny airways in your lungs, the bronchioles, and can cause scarring. The difference is you can treat it, but you can't cure it. So that's why we really try to talk to young people to prevent from doing that. Okay, vapes are tobacco products called electronic nicotine delivery, or e-cigarettes. Vapes that contain nicotine are a type of tobacco product called ends. It's funny how it calls ends. Yeah, you end your life. You see what I'm saying? Other names for vapes may include e-cigarettes, e-cigs, vape pens, vaporizers, e-pipes. Popular brands include Puff Bar, Juul, Vuse, and Smoke. These vapes can contain high levels of nicotine, a highly addictive drug. Under federal law, consumers must be age 21 or older to buy vape products. That's why the governor went after the gas station, because they were selling them like to young children. Vapes come in many shapes and sizes. Some look like cigarettes, cigars, or pipes. Others look like everyday objects such as flash drives or asthma inhalers, which can make them easy for youth to hide from their parents and teachers. On the second page, vapes contain batteries and e-liquids. Vapes can use a substance called e-liquid that may contain nicotine, the same highly addictive chemical found in tobacco. E-liquid also may contain flavorings, propylene, glycol, vegetable glycerin. Vapes have different shapes and comes in different designs. Vaping among the youth is a public health concern. In 2021, the annual National Youth Tobacco Survey found that 2 million youth use e-cigarettes. Look at those stats. Many teens vape on a regular basis, and most choose flavored vapes. 28% use e-cigarettes every day. More than 8% of middle school students who vape use e-cigarettes. So when the grandmother group had me come in to speak on to the grandkids, one is after talking, because I had for kids I get a little bit like to show things. So I had a picture of a lung with a cigarette coming out of it, a black lung. Because kids were responding by visual. I think, want to be creative with them. And so one of the young girls came up to me and asked me, she said, can I ask you a question? She said, I used to get headaches when I vape. She said, now I don't get headaches. She said, what's going on? She was 13. I said, you're becoming dependent. Your body is becoming dependent. And so I would advise that you stop, because before you were responding to it, but now your body like, I'm getting used to this, give me some more. So I told her you need to stop because you're building a dependence, and that can be a gateway to other things. But and then she looked at me, she said, thank you. So anything, that's not saying it would make her stop, but just anything to just get them thinking. Marijuana causes memory loss and headaches. So now, for the person that uses it could be tolerable for them, but the dangerous is now they find that the marijuana is causing heart attacks and stroke. And I know our trauma doctor said if she has to have a surgery, and the patient got to get a surgery and they smoke, she tells them to stop smoking. She said she will not operate on that colon if they smoke. Why is that? Anybody want to guess? Cigarette smoke has carbon monoxide in it. Carbon monoxide damages tissues. And she said, I'm telling you, I remember her telling me this, Michelle, she's a trauma surgeon at DMC. She said, Michelle, they will not heal, and I will not operate on their colon. They have a pre-planned surgery for me to do. They have to stop smoking at a certain time because it would make their colon black. It has to heal. And a lot of times if people smoke, I used to tell a friend tell her she smoked. Tell my wound ain't healing, had surgery. I said, you're smoking. That's why your wound not healing. It's dangerous. It's the chemical. It's carbon monoxide, and your vessels, in your blood vessels, you have an endothelium lining that smoking damages. That's why when people have high blood pressure and smoke, the doctor tell you to stop, because he knows that carbon monoxide gets in that blood vessel and it's going to damage your endothelium lining in your blood vessels. And then smoking constrict your blood vessels. Your heart has to work harder, and you talk about high blood pressure. So with the marijuana, just so you know, a new study by the University of Southern California researchers find that chronic cannabis use, whether it's smoked or consumed in edible form, is associated with significant cardiovascular risk. Here, when it comes to vaccine long-term health benefits, vaccines are essential for long-term health. Economic efficiency, vaccination is a cost-effective strategy. It prevents disease outbreak. So how many have been cut and you went to the doctor and they said, have you had a tetanus shot? Why do you think the importance of, anybody know what tetanus will do? Tetanus will cause lockjaw. You don't want lockjaw. So if you get a deep cut, get in contact with soil, tetanus will lock your jaw where you cannot talk and you can die from it. Diphtheria diphtheria is a type of disease which is covered in our vaccines where you could cough off your lung tissue. These are diseases we should not have to deal with that doctors in the South are seeing because of the anti-vaxxer climate that we're dealing in. You do not want, I used to vaccinate kids for Haemophilus. And one of the things Haemophilus would do is what's called HIV. And one of the things HIV would do, it could close up the child's throat. And a lot of times we don't know, we got a children's hospital. Children's hospital has so many cases of flu. No child should not have to be hospitalized with flu, but what was going on? What was going on with flu? People are not getting vaccinated with influenza. And now we're down low at the peak.